you go ahead. Is it on?
Yep, go.
Hi, my name is Stephanie Lennox, and I'm nominating Lisa Smith for Women's Health Hero of the Year. So what do you do that contributes to women's health?
Well, I run a free clinic called Information and Referral Today. And what we do is we offer information and referral services for women in a wide range of healthcare issues. We started out doing mainly insurance, helping women find doctor's care for women that had no insurance or very little insurance. Because as you know, in order to get good health care, you really do need full insurance coverage, and most jobs do not provide it, or it's so expensive that it's out of the reach of a woman that works part-time or a lot of single mothers. So we started out by referring women to free clinics, doctors that would take whatever the insurance would pay, and allow the women set up on payment plans, thank you. And it started there, and then it grew, because the more we helped people, the more we realized there was more issues that were affecting women besides health care. They also had problems where they needed to find out where to get heating oil, food stamps, and that does affect a woman's health in the long run. If you don't eat right, it does affect your health. If you're cold, it'll affect your health. So we started pitching them up to services like self-help, food banks in the area, how to get food stamps, and then we also started referring women to agencies that could help them with housing, things like that.
I was going to ask what you did, but you answered that in your first answer. So, how does the clinic run?
Well, what we do is a woman can come in on her own, or she can be referred to us by another agency. We turn no one away, regardless of income, race. Anyone that comes through our door that needs help, we will try to do everything we can to help. We've been in business for the last 12 years. I'm funded by grants and private donations, which does help immensely, because otherwise than that, we wouldn't be able to keep our doors open. Like, my landlord lets us have the space for free. I mean, it's not the most glorious space, but it allows us to do what we do. And I started, like I said, just starting out with insurance referrals because I saw a need in the community, and I decided to help, and we just kept doing it.
Do you enjoy what you do?
I love what I do. It's so fulfilling to be able to help. Someone helped me once when I was really down and out, and it made a huge difference in my life, and I felt like I needed to give back to repay for that kindness. I just felt it was something that I needed to do. So like I said, I started out small, and we just keep growing. And it makes a big difference to have those kind of services out there for women, because so many times a woman gets pregnant, she doesn't know whether she wants to keep the child or not. We can provide them, we can refer them to counseling service. If they decide to keep the children, there's agencies out there that'll help with furniture, clothes, food. WIC, government agency that provides food. If they decide they don't want to keep the child, we can help them, provide them, referrals to abortion clinics and counseling before and after the abortion. If they have children that they can't afford to get shoes for, we can get them shoes. We also do take donations of clothing, shoes, bedding, you name it, we'll take it, and we'll find a home for it, because that's what we're here for. But our biggest thing is to help women help themselves. It's not just a handout thing. We want to give women the tools they need to succeed, and especially when it comes to their health care, because again, so many things fall off. If you're not in good health, you cannot take care of yourself or your children.
What's your favorite part about your job?
When a woman looks at me and they come back a couple of years later, I've had a woman come back to me 2 or 3 years later and say, if it wasn't for you, I wouldn't have been able to get the surgery I needed. My children wouldn't have the shots they needed. And I wouldn't have known what to do if you guys hadn't shown me where to go or helped me find the information I need. That's the best part of my job, is when a woman comes back and says that I help them improve their life and improve their children's lives. It makes it all worthwhile.